St. Joseph aspirin is a medication that is used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It may also be used to reduce pain and swelling in conditions such as arthritis. St. Joseph aspirin is known as a salicylate and a nonsteroidal anti-inflammatory drug, NSAID. It works by blocking a certain natural substance in your body to reduce pain and swelling. Consult your doctor before giving St. Joseph aspirin to a child younger than 12 years. Your doctor may recommend a low dose of St. Joseph aspirin to prevent blood clots, reducing the risk of stroke and heart attack. If you have recently had surgery on clogged arteries, such as bypass surgery or coronary stent, your doctor may direct you to use St. Joseph aspirin in low doses as a blood thinner to prevent blood clots. Be sure to follow your doctor's instructions on the daily dosage and the optimal timing for taking St. Joseph aspirin. When taking St. Joseph aspirin for self-treatment, it's important to follow the instructions on the product package. If you have any questions, consult your doctor or pharmacist. If your doctor has prescribed this medication, take it exactly as directed. Take this medication by mouth with a full glass of water, unless otherwise instructed by your doctor. Avoid lying down for at least 10 minutes after taking the drug. If you experience stomach upset, you can take the medication with food or milk. Swallow enteric-coated tablets whole and do not crush or chew them. The dosage and duration of treatment will depend on your medical condition and how you respond to the medication. Be sure to read the product label for recommendations on the maximum number of tablets you can take in a 24-hour period. Do not exceed the recommended dosage unless directed by your doctor. If you are using this medication to treat headaches, seek medical help immediately if you experience trouble speaking, weakness on one side of the body, or sudden vision changes. If you have headaches caused by head injury, coughing, or bending, or if you have a severe headache with vomiting, fever, and stiff neck, consult a doctor before using this drug. Remember that pain medications work best when used at the first signs of pain. Aspirin with enteric coating or slow release may take longer to stop pain, so ask your doctor or pharmacist to help select the best type of aspirin for you. Finally, do not use St. Joseph aspirin for self-treatment of pain for longer than 10 days, or to self-treat a fever that lasts longer than 3 days. If your condition worsens, or if you experience new or unusual symptoms, consult your doctor promptly. If you experience upset stomach or heartburn, it's important to talk to your doctor or pharmacist. However, many people using this medication do not have serious side effects. It's important to tell your doctor right away if you experience severe nausea or vomiting, easy bruising or bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes or skin. This medication may rarely cause serious bleeding from the stomach, intestine, or other areas of the body. If you experience severe abdominal pain, black or tarry stools, vomiting that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or a severe headache, seek medical help right away. In rare cases, a serious allergic reaction to this drug may occur. If you experience symptoms such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Remember, always seek medical advice if you have concerns about the side effects of St. Joseph aspirin. Before taking St. Joseph aspirin, it's important to talk to your doctor or pharmacist if you have any allergies to aspirin, other pain relievers, or certain health conditions such as bleeding disorders, kidney disease, liver disease, stomach problems, asthma, nasal polyps, gout, or certain enzyme deficiencies. This medication can cause stomach bleeding, especially when combined with alcohol and tobacco. It's important to limit alcoholic beverages and stop smoking while taking St. Joseph aspirin. If you have any upcoming surgery, be sure to inform your doctor and dentist about all the medications you are currently using. Children and teenagers under 18 years old with chickenpox, flu, or any undiagnosed illness should not take aspirin, as it may increase the risk of Reye's syndrome. Older adults may also be more sensitive to the side effects of this drug. St. Joseph aspirin is not recommended for use to treat pain or fever during pregnancy. Pregnant women should discuss the benefits and risks with their doctor, as this medication may harm an unborn baby and cause problems with normal labor and delivery. Aspirin can pass into breast milk and may harm a nursing infant when used in large amounts. However, low-dose aspirin for heart attack or stroke prevention may be used if directed by a doctor. Always consult your doctor before using St. Joseph aspirin while breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, and share it with your doctor and pharmacist. And always consult your doctor before starting, stopping, or changing the dosage of any medicines. Some products that may interact with St. Joseph aspirin include mifepristone, acetazolamide, blood thinners like warfarin and heparin, corticosteroids such as prednisone, methotrexate, valproic acid, and herbal medications like ginkgo biloba. Before using St. Joseph aspirin, consult your doctor if you have recently received certain live vaccines, such as varicella vaccine or live flu vaccine. Be sure to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers known as NSAIDs. To prevent an overdose of aspirin, read the labels carefully before taking other pain relievers or cold products to make sure they do not contain aspirin. Daily use of NSAIDs like ibuprofen may decrease aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for prevention of heart attack or stroke, consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain or fever. Keep in mind that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know that you use this drug. If you suspect an overdose with serious symptoms such as passing out or trouble breathing, it's important to call 911 immediately. Otherwise, you should call a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include burning pain in the throat or stomach, confusion, changes in mental or mood, fainting, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. If you use St. Joseph aspirin regularly or at high doses, your doctor may want to do some lab or medical tests to check your liver and kidney function, blood count, and salicylate level. It's important to keep all your medical and lab appointments and consult your doctor for more details. There are many different aspirin products available, some with special coatings and some that are long-acting. If you're not sure which one is best for you, ask your doctor or pharmacist for their recommendation. If your doctor has prescribed St. Joseph aspirin for you to take regularly, make sure to take it as directed. If you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and take the next one at your regular scheduled time. Do not take a double dose to make up for the missed one. As always, it's important to follow your doctor's instructions. When it comes to storing St. Joseph aspirin, it's important to keep it at room temperature and away from moisture and light. Different brands may have specific storage instructions, so be sure to check the product package or ask your pharmacist for guidance. Avoid storing it in the bathroom and do not use any aspirin product that has a strong vinegar-like smell. Keep all medications out of reach of children and pets. When it comes to disposing of St. Joseph aspirin, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.